to the next part of the talk. So the more we went into animations, we felt that the future is going to be 4D. So 2D and 3D we started doing in the form of apps, and then we felt okay, we'll move into four dimensions because ophthalmology is a three-dimensional structure, and we felt a 3D structure has to be given justice by having a 3D imaging, if not 4D. So then we started inventing the augmented reality application in ophthalmology. Again, this is another one of our apps which is available free of cost. The idea about this app being, why not diagnostics as well, because the initial applications that we created was not diagnostics. So we felt 2D is slightly not great for beginning. 3D is obviously very enhancing to the eye and very eye pleasing. What if we can give a technology in 4D? So that is Mr. Aji here demonstrating things in 4D, and at any point in time during the course you can all go and have a live demo. So what Iron Man did is not science fiction. It is, we have brought it into a science based reality. So once you wear that headset over here, you can actually see the things in real time. So that is what we wanted to make. Seeing the Marvel Cinematic Universe, we got inspired, and we felt, what if we can make our own four-dimensional ophthalmic metaverse? Because in ophthalmology, if you see, fundus and OCT, take for example, they are actually two separate entities. We can't really bring the fundus and the OCT together on a single template. What if we are able to make a fundus and take the OCT out from it and take all the slices, and whatever slice that we want, if we are able to customize and see, that will be really great, isn't it? So that's where the idea started to create the hologram. So this is the holographic museum that we created, where you can see him moving through the holographic areas, visualizing the structures. So all these structures are available, and at any point in time, I'll maybe at the end of the session, after the next two talks, we'll have a live demonstration of 5 minutes for all the attendees. So all these structures are available as holograms here. The brain, all the fundus structures, infrared, color fundus, everything is available as holograms. You can use your hand, you can catch the hologram like this. You will be seeing it through your eye when you wear the headset, and through the headset you can actually have a feel of it. It's 4D because you have the hand tracker. You can enhance it. You can view the Miyake Apple view, the gonioscopic view, the electron microscopic view. If you want to go back and view the fundus, you can do that. It's all available on paper, on a thin space. A diabetic patient comes, we do a fundus and OCT. The Once it enters the hospital database, we have this translational software attached to the database. Under 60 seconds, we get the holograms. So now the patients can actually be, the OCTs can also be taken along with their fundus, because we can superimpose one another, and we can choose the layers that we want. What we do in a two-dimensional system, we can actually see it in 4D, and the counseling of the patients can also be done in 4D, where we can enhance our counseling experience for the patient and make them understand that this is why we need to do an anti-VEGF injection. So once the same patient after treatment, you can see the PRP spots, as well as once the injection is done, the edema has now settled down. So again, these holograms are now generated by doing an imaging, and the same process that I showed with our translational software. We are showing how it resolved. Same patient can be counseled again. So anterior segment tools as well. You can see anterior segment OCT, the fundus OCT. They can also be provided as holograms. So complex surgeries like a posterior polar cataract with anterior imaging, you can actually preoperatively plan with the hologram. You get a 360-degree view how we can go and approach these patients, how we want to do the preoperative surgical. So not only we wanted to give it in the headset, we also wanted to give it in the smartphones as well, be it an Apple or an Android. So this is one of the phone applications that again I'll be demonstrating to you at the end of the session, where you'll be using your smartphone with the AR template that I have given to the attendees. So you can actually have a application. Once you have installed it in your phone, you can see the holograms in your smartphone itself. So this can actually help you in teaching, counseling. If you don't have the headset, you can also do this phone kind of a thing, where you can see the three-dimensional pictures, and you can choose your frame of choice and examine these patients. So that is also possible. Complex structures like the cavernous sinus, which can also be seen, can see this is the real time what is happening, and this is the video of the phone display where the cavernous sinus is been 3D. So you can see now the user being is moving 360 degrees, rotating, and seeing the cavernous sinus from different angles, because in theory it is only possible that we see only two-dimensional slices of these kind of complex structures. So augmented reality systems also, we have made all these models possible: fundus, cerebral venous sinus, circle of Willis. The main highlight of our feature is we have used real patient images like the gonio, the fundus, to create these structures. We have published this in Indian Journal of Ophthalmology. To summarize my discussion, my dear friends, we have filed the provisional patent for our applications, and it's useful in 4D ophthalmic diagnostics, 4D telemedicine, 4D AI, toolbox creation, multimodal imaging for retina examination. And you can see any retinal pathology can be examined with the color, autofluorescence, and infrared, such as the retinitis pigmentosa, which is shown here. This is a color. So you can catch it, you can feel the holograms, and you can examine it in 4D. And low vision rehabilitation counseling, useful for neuroanatomy pedagogy, complex neuroanatomy structures uh, that we see in our routine practice, maybe for in the beginning stages of our neuro-ophthalmological clinics, can be studied. All the nuclei are available, cranial nerves, complex neuroanatomical pathways are being made in 4D, so that we don't need to mug up the concepts and we can have a good immersive cognitive learning. So with that, I end my discussion, I end my talk. We'll take questions at the end. I'll also do a quick one-on-one demonstration for that.